Most people don't realize this, but the very medications they trust to control their blood pressure could be silently damaging one of the most vital organs in their body. Right now, as you're watching this, thousands of seniors are taking pills they believe are protecting their heart, while those same pills may be slowly destroying their kidneys. In the next few moments, you'll discover the critical warning signs your body is already giving you, the medications that could be putting you at risk, and what you must do immediately to protect yourself. And here's the shocking part. Studies suggest that up to 30% of kidney damage cases in seniors are linked to medication misuse or side effects. I'm Dr. Jake Miller, and after more than 20 years of treating patients, I can tell you this is something most seniors will never hear from their own doctor. Not because doctors don't care, but because the system doesn't allow enough time for these conversations. Here's the truth nobody tells you. Managing blood pressure is important, but doing it the wrong way can cost you your kidneys. And once kidney damage starts, it doesn't just stop. It progresses, quietly, relentlessly. Let's start with the first dangerous pattern. Most people take ACE inhibitors like they're completely harmless. That assumption is exactly what costs people their lives. Here's what's actually happening inside your body. ACE inhibitors work by relaxing your blood vessels, lowering pressure so your heart doesn't have to work as hard. Sounds good, right? But here's the problem. Your kidneys rely on a very specific pressure balance to filter waste from your blood. When that pressure drops too much, especially in older adults, the filtration system starts to fail, slowly at first, then all at once. Here's the critical detail that separates normal side effects from something dangerous. If you notice swelling in your legs that doesn't go away, a sudden decrease in how much you urinate, or a constant feeling of fatigue that wasn't there before, your body is not adjusting. It's struggling. If you're experiencing those symptoms, that's not just your body getting used to medication. That's a conversation you need to have with your doctor this week, not next month, this week. Now you know how ACE inhibitors can quietly disrupt kidney function. But the next medication is even more dangerous because it hides behind something most people think is completely safe. Most people take diuretics, also known as water pills, thinking they're simply flushing out excess fluid. That assumption is exactly what costs people their lives. Here's what's actually happening inside your body. Diuretics force your kidneys to push out more water and salt. That sounds helpful, especially if you have swelling or high blood pressure. But in seniors, this process can quickly lead to dehydration at a cellular level. And when your body becomes dehydrated, your kidneys lose the fluid they need to filter toxins effectively. Here's the critical detail that separates normal fluid loss from dangerous dehydration. If you feel dizzy when standing up, experience dry mouth constantly, or notice your urine becoming dark yellow or even amber, your kidneys are under stress. If that pattern is happening, that's not just a normal reaction. That's a signal your kidneys are being pushed too far. That's a conversation you need to have with your doctor this week, not next month, this week. Before we go further, I need you to understand one thing. Kidney damage doesn't come with loud warning signs. It doesn't knock on your door. It builds silently. And by the time most people notice it, 70% of kidney function is already gone. Now, the third medication. This one has a body count. Most people take NSAIDs alongside their blood pressure medication without thinking twice. That assumption is exactly what costs people their lives. Here's what's actually happening inside your body. NSAIDs, like common over-the-counter pain relievers, reduce inflammation by blocking certain enzymes. But those same enzymes help maintain blood flow to your kidneys. When you block them, especially while on blood pressure medication, you create a dangerous combination. Reduced blood flow plus reduced pressure equals kidney shutdown. Here's the critical detail that separates occasional use from a life-threatening pattern. If you're taking pain relievers regularly, even just a few times a week, and you begin to feel persistent lower back pain, nausea, or swelling around your eyes, your kidneys are sending distress signals. If that's happening, that's not just aging. That's a warning. That's a conversation you need to have with your doctor this week, not next month, this week. Stay with me through all of these, especially number 5. That one has never once been on any standard list, and yet I've seen it send patients straight to emergency rooms. Now let's talk about a pattern most seniors completely ignore. Most people assume fatigue is just part of getting older. That assumption is exactly what costs people their lives. Here's what's actually happening inside your body. When your kidneys start failing, toxins begin to build up in your bloodstream. These toxins affect your energy levels, your brain function, even your appetite. But because it happens gradually, most people don't connect the dots. Here's the critical detail that separates normal tiredness from kidney-related fatigue. If your fatigue is constant, doesn't improve with rest, and comes with a metallic taste in your mouth or loss of appetite, your kidneys are involved. If you notice that pattern, that's not aging. That's your body asking for help. That's a conversation you need to have with your doctor this week. Hit subscribe right now if you're not already here, because the next symptom is something even experienced doctors sometimes miss. Most people ignore changes in urination. That assumption is exactly what costs people their lives. Here's what's actually happening inside your body. Your kidneys control how much fluid leaves your body. When they start to fail, that control becomes unstable. You might urinate more at night, less during the day, or notice foam in your urine due to protein leakage. Here's the critical detail that separates normal variation from a serious problem. If you see persistent foam, blood, or a dramatic shift in frequency, your kidneys are no longer filtering properly. If that's happening, that's not normal. That's a red flag. That's a conversation you need to have with your doctor this week. Now, here's where it becomes life-threatening. Most people believe swelling is just a circulation issue. That assumption is exactly what costs people their lives. Here's what's actually happening inside your body. When your kidneys can't remove excess fluid, it starts to accumulate. First in your ankles, then your legs. Eventually, it can reach your lungs. Here's the critical detail that separates mild swelling from kidney failure. If the swelling doesn't go down overnight, worsens over time, or is paired with shortness of breath, your kidneys are failing to keep up. If that's happening, that's not minor, that's urgent. That's a conversation you need to have with your doctor within 24 hours, not a week from now. Right now, as you watch this, people are sitting in their living rooms thinking their symptoms are harmless. While you were treating the wrong thing, this disease was buying itself more time. Before you close this video, I need 60 more seconds of your attention. Every single symptom we talked about today, fatigue, swelling, changes in urination, dizziness, dehydration, these are not random. They are connected. They are your body's early warning system. And the difference between catching kidney damage early and discovering it too late is the difference between simple treatment and lifelong dialysis. Here's exactly what you need to do next. Write down every symptom you recognized while watching this video. Don't trust your memory. Write it down. Call your doctor and read that list out loud. Not summarize it. Read it exactly as it is. Ask specifically for kidney function tests, including creatinine levels and GFR. Don't assume they'll order it. Ask for it. And remember this, you're not being difficult. You're being the only person in that room fighting for your life. If this video opened your eyes, like it, subscribe, and share it with someone who needs to hear this before it's too late. And there's something I didn't tell you. There's a specific combination of just 3 of these symptoms that almost always indicates early kidney failure. I'll break that down in the next video.